Hello, good morning. My name is Jo and I am Senior Teacher at Specialist Language Courses, or SLC. Let me just tell you a little bit about who we are. We are OET premium preparation providers, and we're one of the OET All-Stars, which you can find information about on the OET website. We are OET providers. We do online classes for doctors and nurses, amongst other things. We also have our own online course, Reach OET B, which you might be interested in, and we do an writing correction service for OET nursing and medicine. And today I'm going to go through a live correction of an OET nursing letter. And it's what we do with our students, and also on our writing correction service. It's kind of feedback we give, and hopefully it will give you some tips on how you can improve and give you an idea of the sort of things you need to be thinking about when writing your OET letters yourself. So we will have a look at the case notes briefly, and then I will go through the letter correcting it as I go, and we'll also look at the criteria and look at how well this student has done on that. So first of all, let's take a look at the case notes. You might recognize these. These are available, one of the free samples on the OET website, and they are relating to Mr. Peter Dunbar. So briefly, let's have a look at the context for the letter that we're going to be correcting. So we're the nurse at the community health centre. A patient we've been monitoring is moving to another city to live with his daughter. So Peter Dunbar, and we've got his date of birth here. So let's look at the task quickly, first of all. So we're writing a letter to the community health nurse in Centreville, outlining the patient's history and requesting ongoing monitoring. So relevant history, requesting ongoing monitoring. That's the purpose of the letter. So we've got current medications. So he's got metformin, which is for his diabetes, which he's had since 2016. And then he's also got these other medications as well. So we've got a history here. His dietary requirements were managed by his wife. Unfortunately, she died. He's non-compliant with his diet, as we can see here. Obviously, that's when he was diagnosed his oral hypoglycemic agent. Still non-compliant with the diet, blames poor memory. He was educated the need for regular medication. Then he was hospitalized. He had a myocardial infarction. And yeah, he was also given some extra medication and diagnosed with atrial fibrillation. So from October, he started showing signs of diabetic neuropathy, and he's now got restricted mobility. Still non-compliant, various things were discussed, and this is today. Okay, so he's still resistant to his diet. He misses or double doses the medication, and he's not reducing what he should be reducing. Okay, and so he needs this. So let's take a look at the letter that we're going to correct today. So first glance, if we have a little look at it, it looks well set out. We've got the correct letter layout, the address, looks pretty clear paragraphs. So yeah, the first thing to notice is that the address and the date and the reference are all appropriate. So I'd like to write a note there. So letter layout, address, reference, and salutation are appropriate. Yeah, dear community nurse is the right way to start the letter. We don't have their name, so we use their job title. Okay, let's look at the first paragraph, which should give us a clear idea of the purpose of the letter. I'm writing regarding Mr. Dunbar, an 87-year-old gentleman who's being transferred to your care. He requires ongoing monitoring because he's moving to live with his daughter in Centreville. Okay, so I think the first thing to notice here is gentleman is not appropriate. It's a little bit old-fashioned. It is more appropriate to say man or woman. But also, if we have a little look here, 87-year-old, in the case notes, it wasn't given. The age wasn't given, just the date of birth. So I would suggest cutting this, and I will say, well, for two reasons. One, don't waste time. Right, don't waste time calculating age if not given in the case notes. And also, if you calculate it incorrectly, it might reduce your score for content. So, I'm writing about Miss Dunbar, who is being transferred to your care. Maybe give a clearer context so you know where the reader works. Care could be for a district nurse, so to your community health centre. That would be a clearer context. Okay, so he requires ongoing monitoring. Yep, because he is moving to live with his daughter in Centreville. Not quite, not because he is moving to live with his daughter. It's when he moves there, he will need monitoring. Because you've used because, this suggests he needs monitoring because he is living with his daughter. So consider rewording. Yeah, so he's moving because he needs monitoring of his non-compliance and diet, to his diet and medication. So you might also want to be a bit more specific here of his diet and medication, for example. But I think ongoing monitoring is the general purpose. As long as you explain the specifics later, I think that's fine. After moving to live with his daughter in Centreville. Yeah, or better still, you might like to write the context first. So he is moving to live with his daughter, oops, in Centreville and requires ongoing monitoring. Okay, so I think we've got a clear purpose there, clear indication of what the letter's about. So let's move on. Mr. Dunbar has been diagnosed with diabetes in August 2016. So this is the wrong tense. We need to use past simple because we use the time marker in August 2018. So use past simple because you have said in August 2018, which is finished past time. Okay, with diabetes, however, he is not very compliant. He's not being compliant with his medication. Now, I think we perhaps need to mention his medication somewhere. It's not mentioned later in the letter, so it might be a good idea to say this here, for which he takes metformin. I think it's 500 milligrams 3 times a day. Okay. So why do you need to include this medication? You need to include it because you're asking the reader to monitor his compliance to it. So they need to know the details. So mention the medication here because you are asking the reader to monitor this. It is directly related to the purpose of the letter and the care to be given. So they need to know what it is. However, he's not very compliant. Since his wife died in last year, so just last year, he was non-compliant with his medication regimen. So we've kind of got it said twice here, which is not really necessary. So we can just cut out this one here. So, and I'll just add a little note. Repetitive. Okay, since his wife died last year, comma. So you need commas. Put commas after time markers. For example, on admission, comma, in June, comma, etc. Okay, so since his wife died last year, since, because we've got since, he was non-compliant. No, he's still non-compliant now. So we need to use a different tense. What tense would that be? It would be present perfect. So he has been non-compliant with his medication. So you should use present perfect here because you are describing non-compliance which started in the past and continues now. Okay, so let's move on. Blaming, so he's non-compliant, blaming Apple memory, no article, memory is uncountable. Okay, memory is uncountable. Okay. Moreover, he is also non-compliant with his diet. Yes, this is true, but moreover is not appropriate. It's too academic. Not. Okay, with his diet, he drinks 2 to 3 glasses of wine with meals and seems withdrawn. Now, this is no longer true. The 2 to 3 glasses of wine was at the beginning when his wife was still alive. Yes, he still has high alcohol intake, but I don't think we can add the specific using the present tense. It's incorrect. So I would cut that out. This was in the past. He seems withdrawn. The case notes do say that the patient was depressed and upset after his wife died, but they do not say anywhere that he is withdrawn. And this student here has used present tense, seems withdrawn, meaning now, and that's not the case. So this is not correct. It is not mentioned. Oopsie. In the case notes. And I guess it's not making assumptions. Yeah, do not make assumptions. E.g., he was depressed, his wife dying, so is withdrawn. So because because it's not directly stated or linked in the case notes, you shouldn't make these assumptions yourself, okay, unless it's clearly presented in the case notes. So let's move on. In June 2018, comma, good, he was diagnosed with atrial fibrillation following a myocardial infarction, yes, and prescribed okay, that's fine. The new medication, he is also on 5 for his hypertension, great. He takes his medication intermittently, yes, this is true. Okay, in October 2018, has shown signs of diabetic neuropathy. So again, we've got the incorrect tense here. In October 2018, what tense should we use with past time, finished time? We should use past simple. So perhaps we could say something like started to show, because this is when it began. Okay, so use past simple because you say in October 2018. Okay, and he now mobilizes with the help of a walking stick. Yeah, that's absolutely fine. It's giving indication about other issues he's having. We discussed the possibility of a meal delivery service and the importance of adherence to the drug regimen. In addition, he suffered from respiratory infection. Okay, discussing the possibility of a meal delivery service is no longer relevant because he no longer needs it. He's going to live with his daughter. So this is no longer relevant. No longer relevant. He is going to live with his daughter. In addition, he suffered from respiratory infection 2 weeks ago. Not strictly true. This actually was 2 weeks ago in October. This is not correct. It was not 2 weeks ago today. He is no longer taking medication for this, so irrelevant. So I would cut out anything about his respiratory infection. It's no longer relevant. The patient is still resistant and non-compliant with his diet and medication, which he takes intermittently or doubles dose. So this is not quite right here. He doubles the dose, or double doses would be fine. We've got a little bit of repetition here. We've got he takes the medication intermittently. He's still resistant. You know, it's a little bit, so I might cut it out perhaps here. Cut out this and put it here. So we might say something like, he is still resistant to treatment despite education on the importance. And then we could say, start a new sentence, he is non-compliant with his diet and medication. Okay, that's fine. The patient is not appropriate. Use the name, Mr. Dunbar. It's a little bit impersonal. We should use he or the name. This is not appropriate. Use the name for he or she, depending. Okay, so, so a little repetitive perhaps because you've put it in this paragraph here. We might take it out there, but I'll talk about that when giving the feedback on the criteria. So I would appreciate if you could encourage Mrs. Dunbar to follow a healthier lifestyle. So here I would appreciate it. You need to try and get these polite request phrases correct. So the correct phrase to use is, I would appreciate it if you could, blah, 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 blah. Or it would be appreciated if you could, blah, 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 blah. Okay. It's commonly mixed up. I find students sometimes mix up the two. Do learn them, get them right. I would appreciate it if you could encourage Mr. Dunbar to follow a healthier lifestyle. This could be considered a little bit judgmental because you're saying healthier. Even if it's true, I would perhaps make it more factual to follow, let's say, his recommended diet. Okay, and monitor his adherence to the medication. Fine. Now, here, I'm just going to make a note about this. Could be considered judgmental. Present it factually. So, poor in, again, poor in sugar. It could be a little bit judgmental as well in sugar, salt, and alcohol. So, this is quite important, and it's hidden within brackets. So, give this more focus. Yeah. Perhaps move to the previous paragraph. Yeah. Or the second paragraph. Okay, so you might say here, for example, you could put it here or up the top here. Yeah, he is non-compliant with his diet, consuming high levels of salt, sugar, fat, and alcohol. Okay, and if you mention it there, you don't need to mention it again here. Yours sincerely, nurse. Okay, so let's have a little look at how this student would do using the assessment criteria. So if I just show you the criteria, we'll make a few comments based on this. So this is the writing assessment criteria. You'll find it on the OET website. We've got the 6 different criterion. Purpose is out of 3, the others are out of 7. So let's make a few comments about this student's letter and what feedback I would give to this student. So purpose. The main purpose of the letter is clearly stated at the beginning, and it's well expanded at the end and all the details in between. So I think this has been achieved quite successfully. Yeah. Let's look at the contents. The student has included relevant information, and they have the details they need in order to carry on the required action. And there is that clear request for action at the end of the letter. So the reader would know exactly what to do. Timeline's quite clear, you've got lots of dates here, but there's a few inaccuracies. So we talked about this 2 weeks ago, which wasn't 2 weeks ago. And there's a few errors with tenses as well, which can cause a little bit of confusion. And there's some things that happened, in the past, not now here. Also, very importantly, his medication for his diabetes has not been included, and this is key information. So I think that's the main thing about content to note here as well. Conciseness and clarity. The letter is a little bit too long, so you've got quite a few irrelevancies and some repetition, the repetition of taking his medication intermittently. Although it's relevant, I think the ideas could be a little bit more concise and presented more clearly. Some of this in the 3rd paragraph is a little distracting and take away from the main focus of the letter. Genre and style, this has been done quite successfully. As you see here, there's lots of professional language. It's quite factual. There's some effective use of passive. It's generally appropriate. There's a few lapses, but they are not distracting. Organisation and layout, again, I think there's clear paragraphs and the letter layout is appropriate. They've also organised it fairly logically. They've grouped together information about his diabetes in one paragraph, his other conditions in another paragraph, and then a separate paragraph for the request for action. but it's not maintained perhaps within the paragraphs, and a few adjustments would improve a little bit and make the key information easier to find. So this information about his poor in sugar, salt and alcohol is a little bit hidden. So we want to make sure that the most important information is easy to find. And then we've got language. So there are some errors which do cause a little bit of strain for the reader, mainly with tenses here. They do affect the understanding. You know, the reader has to read them again and try and work out, is that now, is that in the past? So I think that could be improved. I would recommend reviewing tenses to the student. There are a few other minor errors, but then they're less intrusive, so not too much to worry about, but perhaps some attention to those would be a good idea as well. So I hope you found this correction and these the feedback useful. This is what we give to our students who have lessons with us. We also provide this on our OET writing correction service. You can find information about this on our website, and there's a link below as well. On our OET writing correction service, you will receive detailed corrections and comments, and feedback and tips on how you can improve in each area of the writing criteria, so that you can improve your score for the OET writing. Okay, so do check out our website. Also, please follow us on Facebook, like and share. We also have a YouTube channel which has lots of really cool videos which can help you improve all areas of the OET exam. So please do check them out. And I hope you found this very useful, and I hope to see you very soon as well. Okay, have a great day or evening wherever you are in the world. Bye, take care.